Fair and Balanced. We're now joined by Republican Representative Michael Burgess for his take on where health care is headed and a new study on the extra costs in the House plan. You know, I don't know if you just heard, Congressman, but there is more spending that's going to come through TARP planning. Of course, Lord knows what's going to happen with cap and trade. What have you discovered recently about the spending in the House plan?
But I don't think it's any great surprise where we are today. The report that came out this weekend by the actuary for the Center for Medicare and Medicaid Services that said that maybe we are bending the cost curve. We're just bending it the wrong direction. And as a consequence, this bill that we passed late Saturday night by the barest of margins actually cost $300 or $400 billion more than what anyone was admitting over the weekend. And I don't disagree with Senator Cardin that yes, you want best practices, you want good medicine to bring the cost down in the Medicare system. But unfortunately, the only levers that we're willing to pull in this debate are those levers that ratchet down provider payments for both doctors and hospitals. And ultimately that's going to cost the seniors who depend on the Medicare system. It's going to cost everyone in the system much, much more in terms of dollars if we continue down that path.
Lately, Representative, though, it sounds like you're a little more hopeful that at least in the Senate there might be an opportunity to have some type of bipartisan rapport between both sides. Is there a possibility? Do you really believe that?
No, in fact, I don't. And I've told several people over this past week that, look, if you're depending upon the Senate to save your neck, it may already be forsaken. We don't know what their bill's going to be, but the fact that you alluded to early in your report where you said this bill is being crafted behind closed doors in Senator Reid's office, that's exactly the same thing that happened on the House side. There was no input, let alone from Republicans. There was no input from backbench Democrats in the bill that we voted on Saturday night. This is a bill that was the House case. It was a bill that was brought to us by 3 committee chairmen who've been there nigh on forever, and the White House. And that's the product they wanted to bring. This wasn't a health care bill. This was a political bill. I have no illusions that the same things are going to happen over on the Senate side.
Congressman, you're a medical doctor as well as a congressman. I should call you doctor first in order of importance. But the fact is that a lot of people look at what's coming out of these various plans and say it's going to limit choice, the choice that individuals are going to have to choose the doctor that they want. We just heard Senator Cardin say choice is foremost in his mind of what he wants as well. With that emphasis on choice, isn't that possibly a way to get to some kind of compromise?
Possibly, but then all of their actions belie that philosophy, and all we hear are the draconian cuts that are going to happen to the Medicare Advantage plans, and fully 25% of Medicare recipients today depend upon a Medicare Advantage plan. We are cutting Medicare to the tune of hundreds of billions of dollars in order to fund a new entitlement. And, you know, guess what? The largest part of that new entitlement is going to be Medicaid for people who earn under 150% of the federal poverty level. We've done nothing new here. There's been no new thinking. It has been expansion of those ideas that have already failed us in the past and are putting us on a path to where it's being fiscally unsustainable. And I dare say, again, on the Democratic side in the House of Representatives, had they known the true cost of the bill that was literally that information was just 48, 72 hours away, why couldn't they have waited just a little bit to get that information available to them? You heard Mr. Foster, the CMS actuary, say he had to do this. Literally, it was a hurry-up job on his part. He had only a few days' time to evaluate the House bill before we voted on it.
All right. Representative, thank you very much for joining us. Representative Burgess and